Dear friends, many of us snore. Now, snoring is not troublesome to us, but it is troublesome and irritating to our partner. Snoring is mostly harmless, but at times, snoring can be a sinister sign of something highly abnormal, especially when during snoring the person stops breathing, which is called as obstructive sleep apnea. In today's video, we shall see what is obstructive sleep apnea and what should one do about it. I am Dr. Prasad Honap, consulting physician, and you are watching Let's Talk About Wellness. In India, various studies have produced different results. In some studies, 15% of the population snores, and in some studies this has gone right up to 80%. Now, what happens during sleep that makes person snore? When a person is in deep sleep, the muscles of the mouth and throat become relaxed, and with each breath, the draught of air coming in and going out, these muscles vibrate, and these vibrations produce a sound, what we know as snoring. People snore when they have nasal blockage or congestion, but they stop snoring when these conditions recover. A habitual snorer is generally a male, though women do snore. He is aged between 30 to 65 years, but even young persons snore when they are obese or have some other problem associated with respiratory tract or nasal passage. Typically, this person is overweight, may have high blood pressure, and especially if he is alcoholic, he may snore much more when he has had a little too much to drink. Though most of the time snoring is not dangerous, snoring can be a symptom of a condition called as obstructive sleep apnea, or OSA for short. Apnea means stoppage of breathing. OSA can be risk factor to many diseases, as we shall see presently. Remember one thing, all those with OSA snore, but all those who snore may not have OSA. What happens in obstructive sleep apnea is, during the sleep, when the person is snoring, because of the obstruction to the respiratory passage, breathing starts becoming shallower and shallower and may stop at times for a few seconds or even for a minute. Now, during this stoppage, which is called as apnea, the CO2 percentage or blood level of carbon dioxide goes on increasing and the level of oxygen starts falling. When the level of CO2 increases to a critical stage, the brain gets a sudden stimulus to kickstart the breathing again, and person suddenly wakes up and starts breathing and may go to sleep immediately. This may happen many times, sometimes even 30 or more times in an hour, and person may not have any recollection of this awakening next day. Who are the people who are likely to develop obstructive sleep apnea? Most common cause is obesity. Excess body weight, especially around neck, can lead to narrowing of the airway. This can cause sleep apnea. Sleep apnea can run in families, suggesting a genetic component to the condition. Certain genes may make individual more susceptible to developing sleep apnea. As individual gets older, the risk of developing sleep apnea increases. This may be due to natural aging process, which can lead to changes in the muscle tone and tissues of the airway. Certain medical conditions such as congestive heart failure, high blood pressure, and diabetes can increase the risk of developing sleep apnea. These conditions may contribute to narrowing of the airway or affect the control of the breathing during sleep. People with structural abnormalities in the airway, such as deviated nasal septum, or enlarged tonsils, or bulky tongue, or a large uvula, can have high chances of developing sleep apnea. What are the harmful effects of sleep apnea? The most important is because of this repeated awakening, the person doesn't have a very sound continuous sleep and may experience daytime drowsiness. This daytime drowsiness may lead to many problems. Number one, this increases chances of traffic accidents if the person is driving. Number two, he fails to concentrate properly or focus on the job at hand. He may not have energy, he may feel fatigue and may not be able to perform his job correctly. These people have increased risk of developing hypertension. They have higher risk of developing heart disease or stroke. They have high risk of developing diabetes. It is also generally found that there is impact on the quality of life of these people, which is very important harmful effect of obstructive sleep apnea. Friends, we will end this video here only. In the next video, we shall see when one should seek medical advice and what you can do at home to reduce the apneic episodes. Thank you very much.